Direct Connection is made by MPT to serve all of our diverse communities and is made possible by the generous support of our members. Thank you. Live from Maryland Public Television, this is Direct Connection with Jeff Salkin.
Hi, everybody. Thanks for tuning in for Direct Connection. Tonight, we begin with one of the great challenges of the holiday season. For some people, it is the task of covering something like this, a gift box with something like this, wrapping paper. For other people, the project looks as daunting as a Rubik's Cube, while for some it's a lot of fun and something that they are experts at. Joining us tonight is somebody who is an expert. That is Bevan Kiefer, who is joining us from Greetings and Readings. Thank you for being with us at a very busy time of the year there. Tell us what you do at the store.
Hi, thanks for having me. So my job here is basically wrap all of the things that no one else wants to wrap, or wrap them when people are just ready to get done with their shopping and just want to have everything wrapped when they get home. So that's what we're here for.
All right, so this is like a layup for you. You do it all the time. You like doing it. Do you understand how for some people it sort of makes them come unglued, so to speak?
I guess I can see it. I love it a lot. So really, your mispleasure is my fortune, I guess. I don't know.
All right. Well, let's tap your expertise here for people who do not have your level of expertise. Give us some tips. What are the do's and don'ts?
Sure. Some of the tips I would say. First of all, make sure that your wrapping paper is pretty tight around your box. Otherwise, it's going to be really hard and kind of sloppy to fold on the ends. So make sure that you're giving it good hospital corners and tightening the edges up and everything. And also cut off any excess paper so that way it'll be a lot less bunchy.
And cut off not too much, not too little.
Not too much, not too little, just enough to fold under, like an inch or two is plenty.
I also really like the way you cut the paper there. That was like one fell swoop.
Thank you. It was pretty satisfying. So then, if you have the means, get yourself a double stick roll of tape, because then people will not even know how to start unwrapping your gift.
I was debating whether to ask the double-sided tape question. So you are not a believer in single-sided Scotch tape?
Well, in a pinch, it will do.
So a true professional really uses the double-sided stuff?
Yeah, absolutely. And if you have a tape dispenser that will sit on your counter so that you don't have to fumble around with it, that's even better.
All right, well, okay, I'm seeing you fold over the end, and then you sort of folded that again.
Yep. So really what you want is for all of your seams to be at the bottom of the box. So I wrapped this box upside down, so that way all of the seams are on the bottom, and so when you flip it over, you have a seemingly seamless gift.
Does it bother you that somebody is going to tear that off in about 3 seconds?
Well,
and
no,
if it's a kid, about 2 seconds.
It will be a true joy for everyone. It's a joy for me to wrap it, and it's even more fun to unwrap, I suppose.
All right, what do we do after we have the wrapping paper on? Are you into ribbons, the stick-on bows? What really completes it?
So what we have here mostly is the tulle ribbon, so it's like a mesh kind of netting, and it's super easy. You just tie it like you would tie your shoes, and then you have a bow that is, it's okay if it gets squished because it'll just fluff right back up. So you don't have to worry about putting all of your gifts in a bag to transport them to a relative's house. So it'll be squished, and then you can just fluff it right back up.
Well, and that's a big issue for people who are transporting a lot of gifts, whether it's Santa's sleigh or some other method. Everything gets lumped in together, and some ribbons get knocked off. But you have a solution for that.
Yeah. Yep, it's tulle.
Okay, so that looked pretty simple. What if you have something that's not a normal shape that you can't fit into the old rectangular box?
Well, you'd kind of just have to treat it as if it is a box. So I just started the same way that I started the other one.
What is it you're wrapping there? I missed it. It's just a bag of something.
Oh, this is Fisher's popcorn. It's a bag of Fisher's popcorn.
Making someone happy.
Yeah. It might be me later. I might have to go buy some. So I just put a little bit of tape on it to hold it down. And don't put too much tape on the item because you don't want to rip it apart. Oops. So I'm just treating this as if it is a regular box.
I saw your scissors caught there for a second. That happens to me all the time.
That was slightly less satisfying.
We'll get them next time. Okay, so this is interesting. Right. So you're setting it up to be like right on the edge.
Yep. Yep. Basically, where the edge of the gift is where you want your fold and your tape to be. And so at the end of this is a little bit too long, so I'm just going to trim it up here. I'm going to trim it right into the trash can. So then I'm just folding it down like I would any other box. It's going to be slightly less beautiful, but...
All right, now you're going to do the same thing.
People will be guessing what it is.
Show us what you're doing there. Turn that back to the camera if you don't mind, because that's sort of the trick, right? The last thing you did was folded that triangle back in.
Yeah,
right?
So before you do that, it kind of looks like this, and that's totally fine. But if you fold it over and just put a little bit of tape on it, the double stick tape, and then just kind of push it in place, it just kind of creates a nice little fold at the bottom.
Well, nicely done.
And then you can make sure it stays down.
And then the other end's fairly simple, I guess.
Yeah, the other way is just as if you were wrapping like something that was flat, like a calendar or a book maybe.
What do you think beginners at this get wrong? What are some beginner mistakes?
Let's see.
Certainly not using the double-sided.
I've trained a lot of people
at the store?
Right. Yep. So I would say probably the biggest mistake is that some people don't get it tight enough on the package. So that way you have really baggy paper on your gift, and it's more prone to tearing and things like that. So it looks better when it's tighter, and it also is more secure on the box.
You have a great selection of paper back there. Does the paper matter? I mean, there's thin paper, thick paper, there's the metallic sort of stuff. There's the stuff with glitter on it. How do you feel about glitter?
Right. I feel okay about glitter, but I know that is not a universal truth. So
yeah, I despise it, but go on.
I would probably stay away from glitter unless you know for sure that they would like it. But I would say a thicker paper is going to be better. Like I said before, with like wrapping it tight, it's not going to rip as easily if the paper is thicker, and it also is just going to be a nicer, it's just not going to feel as fragile when you pick up the gift.
All right, well, before we go, tell me about the service you provide there. Is it just for things that are purchased at Greetings and Readings, or can somebody bring in their convoluted present for some help?
Yeah, you can bring in anything. There is a small fee. They vary in sizes for outside merchandise. But we have plenty of boxes here and plenty of paper. You can also bring in your own paper if that's something that you have grown attached to, or if you set up a paper for each member of your family, feel free to bring that in and we can box up everything for you.
Do they make everyone at the store wear the antlers, or is that a personal choice?
No, that is my personal hair flare that I have decided on.
So we hadn't planned to talk about this, but what's give me your take on the holiday shopping season. Anything moving that surprises you in terms of like the number of people, the amount of business, or any particular gifts that are big this year?
This is weird. It was a big gift last year too. Socks, like funny socks, and Sherpa pullovers are huge. I wrapped a lot of them.
All right, well, nobody better to wrap your funny socks than Bevan Kiefer. Greetings and Readings up in Hunt Valley. Thanks so much for the time. I know you're busy. We appreciate it.
Thanks, it was my pleasure.
Our health segment is up next when Direct Connection continues.
Got an unused vehicle going nowhere? Donate it to the one place that can take you any place. Visit mpt.org/vehicles and support the programs you love on MPT.
The MPT app puts our programs right at your fingertips, so you can choose when to watch, what to watch, wherever you want to watch it. Download it now.
Are you turning 70 and a half this year? If so, you generally have to start spending down your retirement account. Even the minimum distribution can place you in a sticky situation. Luckily, you can now use your IRA to make tax-free gifts. Gifts up to $100,000 will never count as income, but always make a difference. That's icing on the cake.
Make your gift for this year before December 31st. Visit mpt.org/support.
This is a box that showed you a world beyond your own. It was just a box, but the world has changed, and so have we. And now the box can be almost any size or shape. And you decide what you want to explore. Anytime, any place. Break out of the box with PBS.
We are the curious.
Wow!
The adventurous.
Oh!
Those venturing out for the first time.
And those who've never lost our sense of wonder.
Whoa. You seeing this?
We are the hungry.
The strong.
I must be the greatest!
The joyful.
A happy little cloud.
We believe there is always more we can uncover.
More we can explore.
We believe in the capacity for goodness.
And the potential for greatness.
The torch has been passed to a new generation of Americans.
PBS. PBS.
PBS.
In the studio now for our Your Health segment tonight is Dr. Madeline Dick-Biascoechea, Clinical Assistant Professor of Obstetrics, Gynecology, and Reproductive Sciences at the University of Maryland School of Medicine and Director of Urogynecology and Pelvic Reconstruction at the University of Maryland Medical Center. Doctor, thank you for being with us.
Thank you.
We're here to talk about something that's very common, can be very painful, and is little discussed, UTIs. What is that?
UTI stands for urinary tract infections. It's an infection somewhere in the urinary tract, including the kidneys, ureters, bladder, or the urethra.
How common is it? Are there numbers? Is it more women or men?
It accounts to about 7 to 8 million visits to the office every year, and 100,000 admissions to the hospital a year. So it's very common. It is twice as common in women than in men.
How does it typically happen? I mean, obviously, you know, you have an opening in the body and bacteria can get in. That's what happens?
Basically, bacteria can come from the perineum or the area of the genitals or rectum, and then it invades through the urethra into the bladder.
How does somebody know they have one? What's the first symptom?
So symptoms can include urinary frequency, going more than usual to the bathroom, urgency, having to go very quickly to the bathroom, and feeling a very uncomfortable burning sensation when you urinate. They can also have pain in the lower abdomen. Some people can have a fever, and some can even have blood in the urine.
Is pain the first symptom?
It can be anything. Some people have more urgency and frequency, and some people have more pain. Every person is different.
It sounds like one of those things where getting medical attention quickly is a good idea, but it may not be clear to everybody what's going on initially.
So most people, if you're healthy and you increase your fluid intake and the symptoms are not too severe, you can probably clear it on your own. But if the symptoms are severe or they persist for more than 3 or 4 days, you should definitely go to the doctor. And especially the first or second time it happens, you want to go to the doctor very quickly because it's very uncomfortable.
Everybody makes the same association. When I saw on the notes what we were talking about, my first thought was cranberry juice.
Yes.
Is there anything to that as a cure or preventative for UTIs?
So there are a number of things that we use for prevention. Unfortunately, we don't have a great amount of research on this yet, and some of the research is contradictory. But I always tell my patients to, try everything. So I don't usually recommend cranberry juice because it has a lot of calories and you don't want all that extra sugar. So cranberry tablets, there's also increasing the fluid intake, urinating right after intercourse. And for some women that have recurrent urinary tract infections, meaning that they have more than 2 in 6 months or more than 3 in a year, we also may give antibiotics to take every day for prevention.
Preventatively?
Mm-hmm. Or what we call prophylactic.
What would the risk factors be in men for this?
For unfortunately, I see mostly women,
right.
But older men that can have prostatitis or an infection of the prostate and show up with urinary tract infections, and anything that could potentially place bacteria that is in the skin or in the rectum in the urethra.
Is this the sort of thing where we're generally staying reasonably hydrated, drinking a good amount, not a crazy amount of water is a good idea for everybody?
Yes, definitely. Almost 2 liters of water a day is plenty. Making sure you have a good hygiene, especially in women, wiping front to back is very important. So you don't bring the bacteria that's in the rectum towards the vagina or the urethra. And having, in general, a good, healthy lifestyle.
Let's take a phone call. Baltimore County, this is Erica. Thank you for the call. Go ahead.
I'm interested if there is anything in herbs, natural plants to take.
Very good. Thank you for the phone call. Natural therapies?
Like I said, cranberry tablets are good. There's a supplement that's called D-mannose. It's a type of sugar, and you can find it as one of the supplements in the pharmacy. That has been also, in some studies, shown to prevent recurrent urinary tract infections. But that's basically...
If an infection is allowed to continue without treatment, what are the potential consequences?
So certain patients are more at risk of complications during a urinary tract infections. Patients that are immunosuppressed because they're taking certain medications, pregnant women, older patients might get then ascending infections, what we call infections that go up from the bladder towards the kidneys, and that can present a dangerous situation because the infection can go into the blood.
Let's take a call from Harford County. This is Joe. Joe, thank you for calling. Go ahead.
Thanks, Jeff. 67-year-old male, been diagnosed with a distended bladder. Been told I don't completely void my bladder. I'm wondering what are the complications or side effects of that malady,
All right. Thank you for the phone call. Good luck. You don't treat a lot of men, but...
No, but urinary retention can also happen in women. But both women and men with urinary retention can be more at risk of urinary tract infections because there's more of a volume of fluid that doesn't release all the time, and bacteria can then reproduce. It's more of a favorable environment for bacteria to grow.
With women in particular, does it matter if you are somebody who takes showers or takes baths and feminine hygiene products?
So our bodies as women are very good at cleaning themselves. So we don't need any feminine hygiene products. We just need showers, and soap and water is a great thing. If you do baths and you find that you are having more urinary or vaginal infections, then that should be one thing that you eliminate first.
How does somebody know when to see the doctor? And once you've seen maybe a family doctor, when you need a specialist?
Well, if the symptoms are very severe, if they have, if you can't do your regular daily routine, if they have been going on for 3 or 4 days and they are not improving, if you have blood in your urine or you have a fever, and if it's an elderly person and they show signs of confusion, those are all signs that you should be seeing a doctor, either family physician or urgent center. If a patient has repeated urinary tract infections, again, more than 3 in a year or more than 2 in 6 months, they should be treated as recurrent urinary tract infections, and they can be seen by a specialist such as myself as a urogynecologist or a urologist to determine if they have certain risk factors that we can intervene with.
Is there any research going on that's of particular interest, either in diagnosis, treatment, different antibiotics, and so forth?
Definitely. We have many institutions that are researching first on the sensitivity of our testing, because there are a lot of bacteria that have been shown to not show up on the urine culture sometimes. So we're working on having better testing for bacteria in the urine. And we're also working on trying antibiotics that are able to treat resistant infections, which is a very constant struggle for us.
So somebody, in terms of the testing, could have an infection, and I guess it's a urine test would come back negative.
It may,
but it's a bug that's not being tested for.
It's less likely. I don't want to say that it's common, but there are some bacteria that may not show up in the urine culture and still give you symptoms and signs of a urine infection.
Your practice, you also specialize in surgery, pelvic prolapse.
Yes.
Tell me about that. I mean, how much of your practice is in different areas?
So my practice is probably 30% prolapse, in which we help women that have descents in the vagina and uterus, probably 50% incontinence, both urinary and fecal incontinence, meaning that you leak when you don't want to go to the bathroom, or there's leaking of stool as well. And another, how much did I say? 50 and 30. So the other 20%
there's no math on this test. It's okay.
So the other 20% will be recurrent patients with recurrent urinary tract infections, patients that have interstitial cystitis, which is a pain syndrome in the bladder, another variety of things.
In terms of the surgical work that you do, how's that evolving?
So there's kind of a pendulum, right? Before there were no mesh, and then everybody was mesh, and now most people don't get mesh for prolapse, but we are finding better and ways of treating prolapse with better surgeries and more long-lasting surgeries.
Let's get one more phone call. Howard County, this is Kathy. Kathy, thank you for calling. Go ahead.
Yeah, I was just wondering, with the retention issue that the other man spoke about, what does she think about catheterization a couple of times a day to relieve the buildup?
Thank you for the phone call.
So there are a number of different ways to treat retention. First and foremost is observation. If a patient does have retention but can reasonably, although not completely, empty their bladder and they don't have a problem with urinary tract infections or other complications of it, we can just observe. The other two options would be catheterizing a number of times a day. You would have to obviously consult with your physician and see what's appropriate. And then there's a nerve stimulator that we can implant to treat retention as well.
Very good. Doctor, we appreciate your time. Happy holidays.
Happy holidays.
That is our program for this week. Thursday at this time on Your Money and Business, we'll have some last-minute gift ideas. Join us then. Now, for all of us at MPT, I'm Jeff Salkin. Thanks for watching and have a good night.
Your health segments are a co-production of Maryland Public Television and the University of Maryland Medical System.
This program was made by MPT to serve all of our diverse communities.